Gillian Keith.
Thank you, Mr Deputy Speaker. The NHS is without a doubt a much-loved and vital service. Established almost 71 years ago, it has been under the stewardship of a Conservative government for 44 of those years, almost two-thirds of its existence. The NHS treats 1.4 million patients every 24 hours. It is literally where we start our life, is a constant support and safety blanket throughout our lives, and we simply couldn't live without it. That is why the NHS is this government's #1 spending priority. It is beyond question that this government has provided the biggest investment ever into our NHS in the post-war period. The scale of the commitment is mind-blowing at £33.9 billion in cash terms by 2023-24. And if any other government had done it, they would have been celebrating it and they would have spoken of little else. By 2023, we will be spending £157 billion per year, many billions of pounds more than the opposition proposed. My mother-in-law, who was a frequent user of the NHS in her latter years, used to say to me, "You have to be able to cope to be able to care." And I find her words very poignant when talking about our magnificent NHS, because it is vital that we maintain a strong economy to fund the NHS at these record-breaking levels. The biggest danger to the NHS, in my view, is a dangerous experiment with socialism coupled with a £1,000 billion spending commitments. The NHS will literally be competing with railways and utility companies and goodness knows what else for a pot of money that will be much smaller due to economic failure. As someone who has worked in the private sector most of my life, my approach is somewhat different. The private sector has to work well for the NHS to have the funding it needs. And there are other lessons which are relevant in my experience, which is it is reasonable to make an assumption that you can increase efficiency. There are many examples of this across the NHS and many new ways of working. Multidiscipline teams, primary care networks, integrated services, urgent care centres, pharmacy first, GP services online, and much more innovation to come as part of the long-term plan. Mr Deputy Speaker, nowhere have I seen this endeavour for excellence combined with efficiency more than at St Richard's Hospital in Chichester. I want to pay tribute to our wonderful staff and the phenomenal record of the whole Western Sussex Hospitals Trust, led brilliantly by Dame Marianne Griffiths. We are extremely proud that our hospital trust is rated outstanding and was described as effective, caring and well-led during their CQC evaluation. So it's not surprising that the trust has won awards. Over the last 4 years, the trust has won Best Organisation in the Health Service, Best Education and Training in Patient Safety. They've won the Top Hospital Award, and Marianne herself has won Best Chief Executives for 2 years running. We need this excellence equally in all our hospitals across the whole country. Before being elected to this place, I was lucky to serve on the Hospital Trust Board of Governors, where I learned a great deal. Most importantly, I saw their can-do attitude and search for continuous improvement combined with sensible and inclusive leadership that ensured they delivered great results. For those who doubt that the NHS can make efficiency savings year on year while still maintaining top-quality services, Western Sussex Hospital Trust has managed a surplus every year but one since its creation in 2009, wiping out £20.5 million worth of legacy debts. Western Sussex County Council has also stepped up to the public health challenge and only last month launched a new joint health and wellbeing strategy, Start Well, Live Well, Age Well. Prevention through education is a key component of our health and wellbeing, and in West Sussex we have introduced a winter falls prevention programme, tobacco control strategy, alcohol reduction initiatives and programmes to counter loneliness, suicide and self-harm. Listening to the opposition speakers in this debate, you could believe that the system is broken. It is not, and it's certainly not the story in my constituency, where I am lucky enough to work with great people, great doctors, nurses, porters and all the other NHS staff. So it is down, none of this is down to the credit of politicians who often use the NHS as a political football, spreading nonsense and rumours about threats of privatisation. It is down to the committed people in the NHS doing a great job with strong leadership on the ground. Now these are underpinned by the right funding model for the future, the biggest cash injection in the NHS's history, which will be something we should all be celebrating.